Welcome to the pandemic vlog.
Where everything is wrong.
Hashtag social distancing. Alright, so we have a lot to catch up on because we actually didn't vlog over the weekend. It was a very lazy weekend, yeah.
So we'll start with the calendar. So if you recall, on Friday night, there were 96,384 cases. And today, which is Monday, March 30th, 2020, there are 152,212 active cases. So basically we went up by about 56,000 cases in 2 days. Woo! All right. So there's that exciting update. And I guess we'll get started with our headlines. Okay. So the first headline is actually not a headline, it's a correction. In one of the earlier vlogs, I referred to the third coronavirus bill as the Take Responsibility for Workers and Families Act. That's actually not the name of the bill. That's the name of a different bill that actually was not passed. So the true name of the third coronavirus relief package is the Coronavirus Aid, Relief, and Economic Security, or CARES Act. In other news, the CDC has issued travel advisories for New York, New Jersey, and Connecticut. Residents of those states have been urged not to travel out of state for 14 days due to coronavirus. So that's really interesting. I've never heard of a travel advisory among the states. I mean, I'm sure it has occurred in the past. I just haven't been made aware of it. So I thought that was a little bit fascinating. Somewhat relatedly, according to Bloomberg, the news outlet, Rhode Island police are now hunting down New Yorkers. So on Friday, Rhode Island police started stopping cars, incoming cars, or I guess any cars, with New York license plates. And on Saturday, the National Guard began helping Rhode Island police conduct house-to-house searches to find people fleeing New York and demand that they observe a 14-day quarantine, which is crazy. Now, the National Guard's people will also be at stations at TF Green Airport, Amtrak stations, and bus stops. Governor Gina Raimondo signed the executive order permitting such actions in an effort to stem the number of coronavirus cases in Rhode Island, obviously, where many New Yorkers have summer homes. The ACLU has actually criticized these actions. The Rhode Island ACLU executive director, Stephen Brown, said, quote, "Under the Fourth Amendment, having a New York license plate simply does not and cannot constitute probable cause to allow police to stop a car and interrogate the driver, no matter how laudable the goal of the stop may be." Although Trump said he wanted to reopen the economy on April 12th, he has since backpedaled and extended the federal social distancing guidelines to April 30th. Trump clarified that April 12th was, quote, was just an aspiration, and that he expects, quote, great things to be happening by June 1st. My last headline is that according to Vox, Trump suggested there was something fishy about how quickly New York hospitals are going through protective personal equipment. At a press conference on Sunday, Trump said, and I quote, "Something is going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? How do you go from 10,000 to 300,000? And we have that in a lot of different places. So somebody should probably look into that because I just don't see from a practical standpoint how that's possible to go from that to that." He also said that this phenomenon was, quote unquote, worse than hoarding. So again, as we discussed with the respirators, Trump did not know why so many respirators were needed. He apparently doesn't understand why so many masks are needed because he's an idiot.
I'm not sure, like, if he thinks you're going to be using the same mask over and over because
he probably thinks that that's the normal course of business. That's what hospitals normally do.
Just not how germs work.
I just don't understand. I don't understand what he doesn't understand. It's just mind-boggling to me. I can't comprehend. he's just not understanding the enormity of the situation, obviously. And of course, New York healthcare workers were absolutely stunned that he was making this allegation and essentially saying by going out the back door or insinuating that they were stealing supplies or otherwise mismanaging supplies. The people on the front lines of this who are risking their lives right now to save people who are dying of coronavirus don't need the President of the United States essentially accusing them of being thieves at the same time. Like, that's just unbelievable.
And also,
crazy.
He says something is going on. Like, yes, something is going on. Like, something huge is occurring. And yeah, like, we have a huge jump in the resources that we need to fight this. As we should. Like,
because it's a global pandemic. A global pandemic.
As of today, there's been almost 40,000 global deaths. That's astronomical. Like, it's like Bianca saying, like, the people on the front lines, like, they're having a hard enough time, they're having a traumatic enough time, and it's just like, we don't need to make it worse by saying that, oh, something's going on, reporters should look at it. You know what? Let the reporters look into it, because we'll really see how the federal government is not doing what they're supposed to be doing. So sure, let's have them.
Yeah, and we'll see how those masks are getting used, which is what people really need to understand, that they're being used by healthcare workers who are risking their lives to save the lives of others. So yeah, let's have some investigative journalism into that process.
Yes. Like, if you want it, let's do it.
Yeah, let's do it. I want to see where these masks are going and how they're being used, because I'm confident that they're being used by healthcare workers to do what do you think they're doing? Going home and making, like, I don't even know, like.
Right. And honestly, like, I think we've talked about this before, but Bianca was like, there's not a lot of like, investigative journalism even being done around this. Like, and there is, but it's not, like, widely distributed. It's not widely consumed. So you do want kind of more of an exposure about what's going on and what people are dealing with, because people continue to say it's not as big of a deal as it is, and that we're going to be out of isolation by the 12th, or in some cases by the 7th of April, which is where schools were originally supposed to open in this area. You do kind of want some exposure, because there's just things going on that even regular people, like even healthcare workers here, just have no idea is going on, which is really, really appalling. Anyways, we'll get to my headlines. So I will start with a piece of uplifting news, which is that there was a man who was 101 years old, and he contracted the coronavirus. He was born into the Spanish flu, so he did survive that when he was a young child. That was 1918, for anyone who is unsure when the Spanish flu started.
And he also was a World War II survivor.
And he contracted the coronavirus. He was in the hospital, kind of with a serious infection. They thought, like, this dude's 101. He's been, through the mill. Like, we don't expect this to be, something he can survive. And he did. He was like, I did this before, I'll do it again. And then he survived and he went home. So
it is really good news.
Okay, so Trump has been being advised by Dr. Anthony Fauci. And Dr. Anthony Fauci has been great. He's been warning us from the very beginning. He continues to, like he was on Trevor Noah the other day, and he's been on many talk shows recently, so he's continuing to, like, spread the word. Anyways, so he's been just fantastic, and he has obviously a president who just doesn't think certain things are necessary. And so, unfortunately, all of Trump's followers have villainized Dr. Fauci, and they are actively calling him names, but they're also, okay, this says he faces a torrent of false claims that he is mobilizing to undermine the president. So that...
What source is that?
This is the New York Times.
Okay.
So I basically am always on the New York Times. But anyways, I felt like that was really... that stood out to me because, like, what the hell? You know what I mean? Like, this dude devoted his life to this. Like, if he
Knows
were in
what he's
charge,
talking about.
right? If he were in charge, like, we'd all be taken care of. But here we are.
But partisan politics.
Yes.
Partisan politics. It's just what the United States is, quite frankly, best at.
Yeah.
It's really upsetting.
Really is. And sadly, also, ambulances in New York City are now as busy as on September 11th, to give you you know, like, to give you
a sense of the gravity of the situation.
To give you something to compare it to, because, you know, and also, like, September 11th, as bad as it was, you know, one event. This is, and certainly the effects of it were ongoing, and the cleanup in every way was ongoing, but these ambulances are now as busy as 9/11 every single day, and probably for a very long time.
Yeah.
So you can see how overworked that system is. So this is also from the New York Times. This is about more specific about what happened with Dr. Fauci. So basically on March 20th, they were having a White House briefing, and the president was talking about coronavirus. And this says, behind him, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, dropped his head and rubbed his forehead. Some thought Dr. Fauci was slighting the president, leading to a vitriolic online reaction. So this was the catalyst for all of this hatred. So on Twitter and Facebook, a post that falsely claimed he was part of a secret cabal who opposed Mr. Trump was soon shared thousands of times, reaching roughly 1.5 million people.
Oh, God.
So he's just right now a target of this online conspiracy, which is kind of like, we don't really need to focus on this right now. We have kind of a bigger problem, so...
I mean, honestly, the guy's probably just really freaking tired, and he's like,
probably.
Oh, damn, I'm so tired, I'm gonna pass out during this press briefing, like...
And also, like, if he is rubbing his head because he's just so appalled by Donald Trump, like, I can understand that.
Oh, I mean,
we're all doing that in our homes on a regular basis.
I mean, not all of us, but many of us.
Many of us who are the most logical. One anti-Fauci tweet on Tuesday said, "Sorry, liberals, but we don't trust Dr. Anthony Fauci." So again, just very partisan situations going on.
Which is really interesting because Fauci is not a political figure.
No.
Obviously, he's
not in Trump's cabinet. Like
he's not a political figure.
No, I read his.
He's not a.
He's a director of the National Institute of Allergy and Infectious Diseases.
Right.
This
He's
is
not
not a political institution in any way. It's just so interesting because the coronavirus is not partisan, right? Like, there are Republicans dying and there are Democrats dying. So the fact that even they're saying, like, oh, hey, liberals, we don't like Dr. Fauci. Like, okay, you don't have to like him. Like liberals aren't like, Dr. Fauci, you need to like.
Well, I don't care if you don't like him.
I truly don't give a crap. Like, if you don't have to like him if you don't want to. But the point of fact is that if you don't take the measures that he is stipulating, like, you're gonna be ill and people in your family are gonna be ill. Oh, and also, this was really interesting. I flagged it as kind of a headline, mostly for people who are from this area, but it highlights how close to home the disease is. So this is award-winning butcher Arnold's Meats in Chicopee, Massachusetts. It was actually a supplier of the food for my wedding. So they actually make they're really great there. But one of the employees tested positive for coronavirus, so it is shut down.
Oh, wow.
So that is like 15 minutes from us.
Yeah, I mean, the virus is here.
I mean, obviously. It's here, yeah. It's here in Springfield, like, you know.
It's outside the door.
Yeah. It could have been on our gloves earlier. We just don't know where it is.
Yeah.
Okay, also, something very unfortunate happened over the weekend, which was that there was a cruise ship, and again, this information I read on the New York Times, though I don't have the article right in front of me. But a cruise ship disembarked from the shore in the United States. My think like a little over a week ago, and they did not do any screening for coronavirus at all.
Wait, it left port a week ago?
Yeah, I think so. Like they didn't
to
take
embark on a voyage?
Yeah.
What idiots are still traveling right now?
Yeah, I mean, cruises that's like...
Especially on cruises, given all of the cruise ships that have not been able to dock and that have been just infected with corona. Like, what?
Yeah, I mean. Anyways, they're off sailing, cruising, and lo and behold, because you did no screening in this pandemic time, someone on the cruise ship had coronavirus. So as with the Diamond Princess and the other cruise ships that experienced a high level of infections, the coronavirus spread very fast and very well on such confined...
Like wildfire, as they say?
Yeah. As a result, 4 people died on that ship. And the ship was not able to dock. I think they were trying to dock in Florida, like in Fort Lauderdale. And Florida was like, okay. So they're still finding I think they're still finding a place to dock. I'll have to make sure to follow up on that and update. But they were looking for a place to dock, and it was taking several days. You're at sea with like 4 dead people. I'm hoping that those people are off the ship by now. Don't get on cruises, please. Like, no more cruises.
I'm not stupid enough to go on a cruise during I'm not stupid enough to go on a cruise, period.
Like, I'd just rather not.
I'd just rather never go on a cruise in my entire life.
I'd rather not go on a cruise. But yeah. For the second portion of this vlog, Bianca and I had to get a few things. I had to pick up, a medication. Bianca had to get a few things. We were looking for paper towels.
So we went to CVS, which is like a
down the street,
5-6 minute walk from here.
It's really close.
And we were looking for hand sanitizer, paper towels, and nail files. And they were pretty much out of all of those things. They were completely out of paper towels, obviously. I was not surprised. They were completely out of hand soap. So we got dish soap, which I imagine is probably like a fine
if you're
substitute.
using it.
But anyway, they didn't have hand soap, and I have to take these nails off. 2 have already come off, but I still have 8. And so I need to file them off. And all of the nail files were picked over because, you know, everyone and their mom gets their nails done. But we do have some footage to show you from that. And we hope you enjoy. We were really stressed out the whole time.
It was okay. I think that's important to say is that we were we thought we'd be taking a leisurely stroll to the CVS, and it just didn't work out that way. It was very stressful.
It was very stressful, and I'm glad I'm back here in this house. I feel like I could have easily caught corona from just going to CVS. Yeah. But I guess we'll see. Fingers crossed that doesn't happen. Items that you need.
And by the way, let's be kind to the people who are working retail right now. Oh, because people are rude to retail workers on a regular basis. And I've heard that they are extremely unbearable, especially now. And just know that these people didn't sign up for the front lines. And they don't make enough money to be on the front lines.
Yeah.
So
really don't. So don't be assholes.
So do not be assholes, please. And hello.
Hey.
Welcome to the pandemic vlog.
Where everything is wrong.
Hashtag social distancing. Bianca and I have social distanced so well that this is our first foray into regular life again.
A long time.
In a really long 14 days, right?
Yeah.
2 weeks.
Pretty much.
Let's move.
I don't want to go into the store. Look at this parking lot. There's so many people.
But also there's a surprising amount of people on the sidewalk because we've had to jump out the way
a lot.
Relatively a lot. Anyways.
This is a nightmare.
So this is the parking lot of the CVS. Which is basically full. So we're in the CVS. There's certainly not a limit on how many people can be in here. And the medication line is very long for the pharmacy. This is the hand soap and like wipes and cleaning oil. It's like fully there. And there are now, I mean, they don't even have any in here, but they're now limiting the amount of wipes people can get. But this is also all cleaning supplies that is empty. So we're getting dish soap for hand soap because pandemic. Hashtag pandemic. All right. Well, I hated every moment of that. That was actually a really harrowing experience, I won't lie. It was stressful and people were not really maintaining 6 feet of distance. And like... No, not at all. Like literally not at all. Well, like you could tell they were taking measures because, for example, they had tape marks on the floor that were supposed to be 6 feet apart and then a sign that was like, when waiting in line, please stand on tape marks. But they weren't 6 feet apart. Like for sure we're not. No. Two, once you get up to the counter, you're crammed in next to anyone anyway. So... But they clearly didn't have a limit on which customers were going in, and there was no sanitary stations there either. Yeah. So if you didn't bring your own gloves, you're screwed. Don't touch your face. Don't touch your face. I'm going to vigorously wash my hands when we get back. Yeah, and for sure. There definitely were some people who like you could feel their tension as well. And there were definitely some people who were just kind of still like. Yeah. When I was waiting in line, the woman in front of me was like, this is so crazy. I can't believe how many people are getting this. And I was like, yeah. It's really interesting to hear like people being like, oh my God, I can't believe how widespread this is, when like we just like to be informed in our family in general. So I think like we have a better idea of how widespread this is sometimes, because it still seems like even some healthcare professionals are like, oh, it's not a big deal. Like, wash your hands and you'll be fine. And so it's interesting to see, like, the degree of awareness people have to this, because it's, like, one of the biggest things that's ever happened, and there is still a huge degree, like, a huge variation in how much people are, like, really taking it seriously. Yeah, definitely. Which is sad to see. Hashtag Americans. Hashtag pandemic. I never realized how crowded every store is. Like in terms of just how little space there is to navigate the aisles. It's weird the things that you think about now. Yeah, like, the things that you didn't have to think about before, you have to think about like right now. Like overall, it was a poor experience. Yeah. Our method of getting things delivered is much better. Yeah, definitely. That's all from the CVS run. Be kind, be safe, keep your social distance. Yeah, definitely. So, catch y'all later. Hashtag social distancing.